So Andrew Trafford, who is our business manager, has led really bringing all the partners together for the pilot. It's very much a collaborative approach and utilising all of the assets across our community. In particular, we work very closely with all our 6 practices, but also Chorley Council, who have been amazing partners in this whole project.
Well, for the past couple of years we've been working together across different services, so as ourselves as the District Council, together with the police and fire, primary care colleagues and voluntary sector, and we've brought together how we share information, and we've worked through barriers of how we do that, and with a focus on early intervention and prevention.
Okay, so the group of patients that we work with, they received an initial visit from a link worker social prescriber. She went out to see the residents in their own home, and it would sort of be a half an hour to an hour face-to-face visit where she would discuss all the issues and concerns that the patient had with regards to their health, mental health, physical health, social needs, and she would also look to see how engaged that patient was in looking after their own health and well-being. From that appointment, she will be able to signpost them to services which may be able to help, to refer into services which can help. And the idea is that the patient becomes more activated in their healthcare, which we see as being a key way of helping these people, helping the population.
So I've been working with the GP networks, and I have been going out to patients from the cohort, and I'm the link between the GPs and then the patient.
From a physical point of view, we sort of do the health walks, sort of low-level walks. We've got the Couch to 5K, those who are just looking to get into physical activity, as well as sort of different leisure centres that run different activities, more outdoor and environmental type projects. We're planting community gardens, community orchards, we refer into, and then other sort of like mother and tots groups. We've got little natter groups, coffee mornings, choirs, so a real broad range of different things that people can get involved into.
So the data itself has been really interesting in terms of how it aligns to the patient's clinical need, and some of the themes that we've seen around links between frailty and, for example, the need for an assisted bin collection have been quite obvious, I suppose, but equally insightful in terms of understanding the wider needs of that person, and how the clinical need may also mean that they have a whole range of other needs as well around mobility and ability to access other services. So I think it's been really interesting and really exciting to see how all that data is coming together to build that picture beyond health and beyond that presenting clinical need.
And what's been really good is actually working in primary care, working on the front line. It's been really quite brilliant, because it kind of reminds you that you're there for patients, and we're kind of like hidden away in a box, battling there with spreadsheets and mainly looking at acute data, to be fair. So actually kind of bringing those skills forward to the front line has been really quite refreshing.
So as a nurse, we see people primarily for health problems, chronic diseases, health problems, medications, and the benefits of working within the population health projects has been with work with other services that help us look at other factors such as social problems, financial problems. So rather than just looking at one aspect of the person, we're able to look at the whole person and identify what we can do to help make changes for them and improve their health and well-being.
It's been an opportunity for us to work together as practices with our neighbouring partners in the local neighbourhood to establish and strengthen our relationships with the other partners such as the Chorley Council, and that's allowed us to design a service which has benefited our cohort of patients.